Centers for Disease Control and Prevention, Tom Frieden on Sunday warned the U.S. could see a large outbreak of measles. We're very concerned by the growing number of people who are susceptible to measles and the possibility we could have a large outbreak in this country as a result. There are 102 reported cases in 14 states. U.S. is likely to see more cases. On the right, they're claiming this is because of all those kids from Nicaragua. They somehow, all those kids had measles, even though they get inoculated at the border and they're checked. But of course, this is because of immigration. All of a sudden, at a time where we have as little undocumented immigrants in this country, or at least coming from over the border, now we're getting the measles. Look, the bottom line is there is a growing anti-vaccination movement in this country, and it is a broad coalition on the left and the right. It doesn't break down in terms of political. I don't even think it breaks down in terms of socioeconomic. Upstate, when we were up there was a lot of people who would not vaccinate their kids. They would not give them antibiotics for like the whooping cough. And people who they live on farms, they just don't believe in it. Then I've met people who are like from California, like Hollywood types. And so it crosses, I mean, look, I get it insofar as you're terrified. Your baby's so small and you're terrified at injecting them with something. It's just scary. It's just scary. But the reality is that measles are real. Rubella, mumps, these are real things. The flu is real. And you don't give a flu shot to a little kid, but everybody else got to get the flu shot around the kid. And yes, I think with measles, I think 1 out of 6 kids gets a fever within like a month or so. Yeah, there are side effects. But on balance, what it does is it keeps measles from spreading. Are there kids who have reactions to vaccinations? Yes, there are. But there's far more who die of the flu. That's just the reality of it. Now, there are some, like, for instance, we had for Mila, we had a doctor who had some holistic practices, but was essentially some combination of, was affiliated with a hospital in New York and they were careful not to have thimerosal in their flu shots or whatever the other shots were. And we were able to spread out the schedule. And I don't know if there's anything, there's any data to support that it's safer to do that. There's probably not. It was really more for our own sort of sense of like, maybe if we spread it out. And really the danger is in doing that is only what is the kid potentially going to be exposed to? Now, depending on where you live or if you're, and what your socioeconomic status is, the chances of you being exposed to hepatitis C, for instance, can be higher or lower based upon your socioeconomic status and what part of the country you live in, et cetera, et cetera. If someone's able to have, or wants to, have a stay-at-home parent and they keep the kid inside all day and as opposed to like sending them to daycare or I guess a nanny, it changes the risk factor there. But ultimately, at one point, the kid's going to go out and they need to be protected. And it's not just for the sake of that kid. It's also for the sake of herd immunity. That's just basically it. you can keep I mean, polio, schmolio? Like, really?
Really the name of a site someone sent you?
No, I saw a piece that someone had written, measles, schmeasles.
Measles, schmeasles by Nelson
It's crazy.
Mandela.
It's crazy.